Hello, everybody. My name is Ed Hurvitz, and I'm the professor and chair of Department of Physical Medicine and Rehabilitation at Michigan Medicine, the University of Michigan. Our Molnar grant-funded study is the feasibility of adding grip strength measures to body composition assessments in individuals with cerebral palsy. As you see, there's a large team, which consists of our adults with pediatric onset disability program and our cerebral palsy program in the Department of Physical Medicine and Rehabilitation. Children with cerebral palsy have an altered body composition and low strength. They have high fat mass and low fat-free mass. This is why BMI is a poor measure for them to look at their body fat mass and their risk of eventual chronic disease as they go into adulthood. Adults with cerebral palsy are at high risk for chronic diseases. The research in our laboratory has shown that they're at risk for cardiovascular diseases, renal diseases, musculoskeletal problems, respiratory diseases, and others. We do not know the natural history. We do not know the natural history of the risk of chronic diseases and cerebral palsy. There's this phenomenon called early aging, which involves early functional loss, which is most likely related to these chronic diseases, but we really don't understand the history. We do not know enough about altering the risk through intervention. We do not know the best tools for screening for chronic disease risk. Studies of body composition are often complex, like a DEXA scan. Other factors aside from body composition are important. Grip strength is an established biomarker of health. It's not well tested in cerebral palsy. It's highly correlated with other measures of strength. A weak grip is associated with an increased risk of functional disability, fracture, cardiometabolic disease, musculoskeletal morbidity, and early mortality in studies of other populations. Weak grip is also associated with cardiometabolic health in children and adolescents. The goal of our study will be to test the clinical feasibility and reliability of body composition and hand grip measures in a clinic setting on individuals with cerebral palsy. The long-term goal will be to have a set of measures that can assess risk and the effects of intervention on risk and potentially add these measures to the Cerebral Palsy Research Network, otherwise known as the CPRN. The specific aims of the study are aim 1, to assess body composition during a clinic visit for children and adolescents 8 through 17 years old and adults with cerebral palsy, including body mass, waist-hip ratios, and skin folds. Aim 2 is to add grip strength measures to assess strength, and aim 3 is to add a self or proxy report disease outcomes, and then to do some analyses on feasibility of doing the measures, and then looking at some exploratory analyses of the correlation between the measures and the chronic diseases. Our group wants to thank the Foundation for Physical Medicine Rehabilitation and the folks who established the Molnar Grant for funding the study, and we look forward to sharing the results with you.